HIV, or the human immunodeficiency virus, attacks the body's immune system, specifically targeting CD4+ T cells. When HIV enters the body, it makes copies of itself within these cells, gradually destroying them. This weakens the immune system, making the body more vulnerable to infections and diseases. Without treatment, HIV can progress to AIDS, the most advanced stage of HIV infection. People with AIDS are highly susceptible to a wide range of opportunistic infections and cancers. It's important to note that HIV is not the same as AIDS. HIV is the virus that causes AIDS. With early diagnosis and proper treatment, people with HIV can live long and healthy lives without developing AIDS. HIV infection progresses in stages, each marked by specific changes in the immune system. Stage 1. Acute HIV infection occurs within 2 to 4 weeks after exposure, with rapid virus replication and high viral load. Some people may experience flu-like symptoms, but many may not have noticeable symptoms. Stage 2 chronic HIV infection can last for several years without significant symptoms, but the virus continues to multiply. Regular HIV testing during this stage is crucial for early diagnosis and treatment. Stage 3, acquired immunodeficiency syndrome, AIDS, is characterized by a severely weakened immune system. People with AIDS have a very low CD4+ T cell count and are highly susceptible to opportunistic infections and cancers. These infections can be life-threatening and are often the cause of death in people with AIDS. Common opportunistic infections include pneumocystis pneumonia, toxoplasmosis, and Kaposi's sarcoma. Early diagnosis of HIV is crucial for timely treatment initiation and improved health outcomes. Antibody-antigen tests detect both HIV antibodies and antigens in the blood and provide rapid results. Antibody tests detect HIV antibodies in the blood or oral fluid and can provide results within 20 minutes. Nucleic acid tests, NATs, detect the presence of HIV RNA in the blood and are the most sensitive type of HIV test. NATs are typically used to diagnose HIV in infants born to HIV-positive mothers or in cases where other tests are inconclusive. It's important to note that HIV tests have a window period, which is the time between infection and when the test can accurately detect the virus. The window period varies depending on the type of test used. Regular testing and early diagnosis are key to managing HIV effectively. Knowing your status helps in taking timely action and preventing the spread of the virus. Early treatment can significantly improve health outcomes and quality of life. Antiretroviral therapy, or AAT, is a life-saving treatment that has revolutionized the lives of people living with HIV. ART involves taking a combination of antiretroviral drugs that work by suppressing the replication of the virus in the body. How ART works. ART drugs target different stages of the HIV life cycle, preventing the virus from entering cells or blocking enzymes needed for replication. By suppressing viral replication, ART reduces the viral load in the blood. Benefits of ART. When taken consistently, ART slows down HIV progression, strengthens the immune system, and reduces the risk of transmission. When the viral load is undetectable, the risk of transmission is effectively zero. Types of ART drugs. There are several classes of ART drugs, each with a different mechanism of action. A typical ART regimen consists of 3 or more drugs from at least 2 different classes. This combination therapy helps to maximize viral suppression and prevent drug resistance. It's important to note that RT is not a cure for HIV. It's a lifelong treatment that needs to be taken consistently every day, as prescribed by a healthcare provider. Adherence to HIV treatment, or taking ART medication exactly as prescribed, is crucial for the effectiveness of treatment. Consistent adherence to ART is the cornerstone of successful HIV management. When ART medication is not taken as prescribed, it can lead to treatment failure and increased viral load. Poor adherence can also lead to the development of drug resistance, making the virus harder to treat. Several factors can affect adherence, including side effects, mental health issues, substance use, and stigma. Healthcare providers can work with people living with HIV to develop strategies to improve adherence. These strategies may include simplifying medication regimens, addressing side effects, and providing adherence counseling. Using once-daily pill regimens or long-acting injectable formulations can make it easier to take medication as prescribed. Counseling can help people understand the importance of adherence and develop strategies to overcome barriers. Support from family, friends, or support groups can play a significant role in improving adherence. Effective adherence to ART ensures better health outcomes and reduces the risk of HIV transmission. Opportunistic infections, or OIs, occur more frequently in people with weakened immune systems, such as those with HIV. These infections are caused by organisms that usually don't cause illness in healthy individuals. Common OIs include pneumocystis pneumonia, toxoplasmosis, Mycobacterium avium complex, and candidiasis. The best way to prevent OIs is to maintain a healthy immune system through consistent RT adherence. In addition to ART, prophylactic medications can be taken to prevent specific OIs. Vaccinations for influenza, pneumococcal disease, and hepatitis B are recommended for people with HIV. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate sleep, can support the immune system. Proper food handling and consumption of safe water can reduce the risk of foodborne and waterborne infections. Treatment for OIs typically involves antimicrobial medications such as antibiotics, antifungals, or antivirals. Early diagnosis and treatment of OIs are crucial for improving outcomes. Regular medical checkups and monitoring can help detect and manage OIs effectively. Staying informed and proactive in managing health can significantly improve the quality of life for people living with HIV. Preventing HIV infection is paramount in the fight against the global HIV/AIDS epidemic. Practicing safe sex is crucial for reducing the risk of HIV transmission. Consistent condom use during sexual intercourse is highly effective in preventing HIV and other sexually transmitted infections. Limiting sexual partners and knowing your partner's HIV status are essential for making informed decisions about sexual health. Pre-exposure prophylaxis, or PrEP, is a medication that can prevent HIV infection in people at high risk of exposure. PrEP involves taking a daily pill that contains 2 antiretroviral drugs and is highly effective when taken consistently. Post-exposure prophylaxis, or PEP, is a course of antiretroviral medication taken after potential exposure to HIV. PEP must be started within 72 hours of exposure to be effective. Other prevention strategies include needle exchange programs and blood safety measures. Providing sterile needles and syringes to people who inject drugs can help prevent HIV transmission. Screening blood donations and using sterile needles for medical procedures are critical for preventing HIV transmission. Male circumcision has been shown to reduce the risk of HIV acquisition in men. Living with HIV can present unique challenges, both physical and emotional. While RT has significantly improved the lives of people living with HIV, the virus and medication can still cause side effects and long-term health complications. Managing these side effects and coping with the stigma and discrimination associated with HIV can be challenging. Living with HIV can also take a toll on mental health, leading to feelings of fear, anxiety, and depression. Stigma and discrimination can exacerbate these feelings, leading to social isolation and reduced self-esteem. Having a strong support system is crucial for people living with HIV. Support groups provide a safe environment to connect with others who understand their experiences. These groups offer a space to share information, coping strategies, and emotional support. Seeking professional help from a therapist or counselor can be beneficial for managing the emotional challenges of living with HIV. Mental health professionals can provide coping mechanisms and guidance on navigating relationships and disclosure. The fight against HIV/AIDS has made significant strides over the past few decades. Advances in treatment and prevention have transformed HIV from a death sentence to a manageable chronic condition. Research continues to focus on developing new and improved treatments for HIV. Long-acting ART formulations could improve adherence and reduce the frequency of medication administration. Gene editing therapies like CRISPR-Cas9 hold the potential to cure HIV by targeting and eliminating the virus from infected cells. Therapeutic vaccines aim to boost the immune system's ability to control HIV replication in people already living with the virus. The global community has set ambitious goals to end the HIV/AIDS epidemic by 2030. Achieving this goal will require expanding access to testing and treatment, addressing stigma, and investing in research. The progress made in HIV/AIDS research, prevention, and treatment gives hope for a future free of HIV. Through continued collaboration and innovation, we can create a world where HIV is no longer a public health threat.